We're going to conclude by looking at some dream varieties, including recurrent dreams, nightmares, lucid dreams, and creative dreams. 50 to 80% of college students report having recurrent dreams. Recurrent dreams can continue to occur over a period of a few months to many decades, and their frequency can range from a couple of times per week to a couple of times per year. They are most likely to begin in childhood, next in adolescence, and least likely in adulthood. About 2/3 are nightmares, mostly involving the dreamer getting chased or attacked by others, or threatened by natural disasters like hurricanes or floods. For many, they eventually cease, but not for all. If they reappear after a period of absence, it's usually during times of waking life stress. So, what do we know about nightmares? Nightmares are dreams that result in feelings of extreme fear, horror, distress, or anxiety. They usually occur in the latter half of the night and can often awaken the dreamer. Frequent nightmares are most common in children beginning before the age of 10. In fact, they are so common they are considered a normal part of development. Most people outgrow frequent nightmares, but not all. Anxiety and stress can trigger nightmares, as can some medications or withdrawals from some meds. Excessive alcohol consumption, eating just before bedtime, and some sleep disorders. And nightmares sometimes appear without any clear trigger. Until recently, research on nightmares was focused on looking for dysfunction. Researchers tested and compared people who had frequent nightmares with none of the clear triggers with those who do not. They hypothesized many deficits, such as IQ, mental health, and physical health, but found no differences between the groups. Interestingly, research on nightmares now focuses on possible functions. The current leading theory is that nightmares can help us to process and move on from past stressors and trauma, and possibly even help prepare us for future stressors and trauma. Lucid dreams are those in which you are aware that you are dreaming. A small percent of people are self-avowed lucid dreamers and extensively study and practice gaining some partial consciousness in their dreams. This partial conscious phenomenon has been scientifically verified in a number of studies. In a typical such study, self-avowed lucid dreamers have been given an instruction before going to sleep in a sleep lab to give a prearranged signal when they are having a lucid dream, like perhaps twitching a finger 3 times. Often they are able to do this even while their brainwaves show that they are still dreaming. Some dream researchers believe that lucid dreaming is functional because the dreamers are sometimes able to change their dream in a functional way. For instance, turning a nightmare into a more pleasant theme. Other dream researchers caution against messing with your dreams, believing that dreams have their own agenda and controlling them could upset their natural function. So research concludes that lucid dreaming can happen with sufficient motivation and effort, but it is not a normal function of dreaming. It has been found that you can increase the odds of introducing lucidity into your dreams by setting up a signal, a cue, then reminding yourself frequently before falling asleep. For instance, if you suffer nightmares in which you find yourself having difficulty screaming, you might use this as your cue and remind yourself frequently before falling asleep at night that you do not have this difficulty screaming in waking life. So if this occurs, you can know that you are dreaming. Can dreams provide creative solutions? 3 criteria must be met for the possibility of dreams to provide creative solutions to problems. First, dreamers must be highly involved with trying to find a solution to a problem in their waking life, increasing the chance that they dream about it. 2, they must recognize the solution in the dream should it occur. And 3, they must retain memory for it. Because of these criteria, most creative solutions come from wakeful rumination, but some examples of famous dream-derived solutions exist. Even more common is the incident of artists finding inspiration for works of art in dreams. A more interesting question is this: how can less rational processes produce creative solutions at all? Creativity often requires thinking outside the box. And as you know by now, dreams involve a reduction in logical thinking, thus removing many seemingly logical boundaries. Before we conclude, here is a final word on dream analysis or interpretation. As we have discussed, although dream analysis is not a science, there are many things we can and do study about dreams scientifically, as you've begun to see, like their content, form, processes, functions, dysfunctions, and more. Also, dream interpretation is not a science, but neither is tennis, nor dancing, nor reading. But these things can still be enjoyable and entertaining. And every poet, painter, writer, sculptor, etc., knows that inspiration can be found in anything, including dreams. We will revisit attempts to interpret dreams later in this class when we explore theories of dreaming past to present. This concludes our lecture on dreams, the noun. Our next lecture will cover dreaming, the verb. In other words, we will next explore the process of dreaming.